First, I would like to ask you if you give me permission to put this material on internet for other people to get the experience of what you have been experiencing during these visits with us. Do I have your permission to?
Yes, you do.
Excellent.
Yes.
Now, tell me, you and I, we met about last year, sometimes in the middle of the last.
Midsummer sometime
Yes.
in there.
And I remember you had very bad back pain and leg pain, is that correct?
Yes, I had pain going down my left leg all the way to my ankle.
Okay, now, 1 to 10, how bad was that pain?
It was very, very bad. I finally was resorting to taking pain pills, medication, and I don't like pain pills.
And after we met, what was the first thing we did?
You recommended that I start doing some therapy to strengthen...
Physical therapy, right?
Physical therapy to strengthen my muscles in my back so that it would support me better, because my core muscles and stuff were weak.
Yes, we did that for a significant amount of time, but...
I think I did therapy for 6 weeks, and then I continued doing it at home. And
at the end of that, I understand your pain wasn't still acceptable to you, so we decided to do surgery.
Correct.
And tell me, what kind of surgery did we do?
We did the little tiny incisions of
Yes,
6 or 7,
Correct.
and you went in there and fixed.
We did a minimal invasive
Yep.
interbody fusion, which is called OLLIF. And just tell me about your experience. How was the surgery? How were you in the hospital?
I was fantastic in the hospital. I got up and walked across the room about an hour and a half after recovery.
Excellent.
And the girls walked with me. I could do the steps the next day.
Okay, and how long did you stay in the hospital?
Well, I only stayed, I think surgery was like Monday. I went home Wednesday, and I could have went home earlier if I would have had a bowel movement.
Okay, excellent. Well, now after the surgery, tell me a little, just realistically, how were you doing at home, and how long did it take for the pain to subside, and how are you doing now?
I did good at home. In fact, my children were surprised because I didn't have to go to any nursing home or anything, and I did the normal walking around. I didn't sit too long, and I just kept moving, and I did use a 4-wheel walker for a while, and then I quit that, and I quit my pain pills. I had no pain.
Excellent.
12 days after surgery, I was done with the pain pills, and I haven't needed them, and I'm back to walking over 2.25 miles a day if I choose.
Excellent.
And I didn't think when people say surgery, I see, I don't even feel like I had surgery. It was so good.
Excellent. Well, I'm very happy, and I thank you for sharing your experience with us. And the objective of this talk is, to distinguish between the open and minimal invasive surgery.
Right.
And many of those open surgeries do have longer recovery time.
Yes.
And obviously with your minimal invasive surgery, the recovery was much faster. Well, thank you very much.
Thank you.